Welcome back. We're answering your questions about the coronavirus with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. Remember, you can always text your questions, the number at the bottom of your screen. That's 379-5775. All right, Dr. Snyder, this person texts, what if you're traveling by car, you're seated in the back seat, the adult that is driving is smoking a cigarette. Can the smoke that I smell from the cigarette carry coronavirus droplets to my seat in the back?
So we feel that traveling in a car, especially if somebody is unmasked, right, is actually quite risky, given that you can't, sit greater than 6 feet apart. The recommendation would be that everybody wears a mask who's within the vehicle. I would try to keep the windows down and probably not smoke inside the car because you're exposing others to secondhand smoke.
Mm-hmm. All right, this next question is, there are so many political candidates coming to North Carolina. Is it safe for those political rallies to be held with all of those people?
So the one good thing about those political rallies, it appears that they are outdoors. However, you are, meeting, if you attend those rallies, depending on the size, it does increase the likelihood of coming in contact with somebody that has COVID. It's especially important that everybody wears a mask if they're attending these political rallies. We know the stats in our community that if you are in a group of 25, you have like 1 in 4, 1 in 3 chance of running into somebody that has COVID. So again, that's why it is so important not to go out in big groups. And the ways you can minimize it is definitely wearing a mask and like spatial distancing from others, and try to stick to small groups.
Mm-hmm. This person says, from what I understand of the virus, it's not from touching items. We get to go food from restaurants. So why would we either A, wear gloves, or B, put it in the fridge, or swap it out with candy from home? Why do we need to do that?
That is very true. I think we are finding out more information that fomites are not as big of a contributor to catching COVID. However, the key thing is that you don't know how in terms of in the restaurant, the risk is actually being indoors with a number of people not wearing a mask. In terms of going out for trick-or-treating, I think the risks is more on the lines of going to someone's house and being within 6 feet of them, and if the person giving out the candy is not wearing a mask, that's considered a little bit of a risk.
Mm-hmm. This person says, is it okay to pull your mask down in public when no one is around?
Yes, it is okay to be occasionally, it does become very challenging to wear a mask all the time, and you might have an itch, or just want to get a drink or something like that. So if you are safely like 6 feet, at least 6 feet apart from somebody else, and just pulling down your mask, you may, and putting it back on. The thought about exposure is that if you are within 6 feet of somebody that may have it, and you have even if you have repeated exposure to somebody within 6 feet that ends up to being more than 15 minutes, then you potentially have been exposed enough to contract COVID-19.
This next text question is, when you juul or use an e-cigarette, do you have a higher chance of getting COVID?
So I think it just depends on who you're with, and then also depending on smoking, and if you have any underlying lung issues from it, that's what can actually put you at risk for a worsening disease when getting exposed to SARS-CoV-2.
So it's not that you are more apt to get COVID, but if you did get COVID, it could have greater implications.
Correct.
Okay. This person is asking, I work in a healthcare environment. Should I be wearing an N95 or just a surgical mask?
So it depends on what the activity that the healthcare employee is doing. if you are working with patients that are not masked and that may have respiratory symptoms and coughing a lot, or if you're doing any procedure that causes an aerosolizing kind of exposure, then you should be wearing an N95. Generally, wearing a regular surgical mask and some eye protection provides plenty of protection for the healthcare worker. And then even better is making sure that the patient is also wearing a mask.
I've noticed many times that people wear their mask and they cover their nose and their mouth, but then when they go to talk to someone, they pull down their mask.
Yeah, it is. It's challenging. I think sometimes, patients, some people may complain that they can't hear enough, or it just sounds so muffled, and occasionally people drop down their mask. Ideally, you shouldn't be pulling off your mask, and aim to talk louder. And if you have to take off your mask, you should definitely be greater than 6 feet away from the person that you're talking to.
All right, we're going to continue on with Dr. Snyder from Cone Health. You can continue to text your questions. We'll be right back after the short break.